Hello and welcome everyone. My name is Kim Krzanowski and I'm the Director of the Office of Early Learning. Today we will be having another DHSS Zoom weekly conversation, and today's topic is going to be geared towards childcare. I have a few speakers with me and I'd like to take a minute to introduce them. First, Meredith Seitz is the Chief Policy Advisor for the Department for Services for Children, Youth, and Their Families. Jamie Mack, Chief Health Systems Protection, Division of Public Health. And Melanie Thomas-Price, founder of A Leap of Faith Child Development Center. Meredith, I'm going to turn to you for a few brief remarks.
Sure. Hi, everyone. Good morning or good afternoon. Again, I'm Meredith Seitz. I'm the Chief Policy Advisor with the Department of Services for Children, Youth, and Their Families. I work directly with the Secretary on policy issues, legislation, and during the COVID crisis, a lot of what we've been working on has focused on childcare, as you can imagine. It's obviously something that weighs on every parent, every provider, every employer. It really touches all aspects of our economy, of our daily life in this state. So the Office of Child Care Licensing falls under the Department of Services for Children, Youth, and Their Families. We call it the Kids Department. Actually for another 20 or so days until it goes over to where Kim works at the Department of Education. But again, the Office of Child Care Licensing, OCCL, does fall under our department. The main goal of that department is to license child care providers. That means both the centers that serve a large amount of children, and then also the in-home providers, which generally serve a smaller number of children at a time. Our main goal with the Office of Child Care Licensing is to ensure that children are safe and that they have a nice and healthy environment in which to learn, and really places that parents feel comfortable sending their children day after day. So obviously that's taken on a whole new meaning during the COVID crisis. We, as you probably know, have restricted childcare to just those essential workers and to businesses that are open, where parents cannot work from home. So that has been kind of the status quo over the last couple months, but as the governor announced, as we move into phase 2 on June 15th, childcare will be once again available to any family that needs it. So that means that families who need to return to work are able to send their children back to their provider if their provider is reopening on June 15th. And those providers will be opening under some additional restrictions. They're basically the same restrictions that have been applied to the emergency providers. Now all providers are allowed to open under those restrictions, and those restrictions have been developed through a lot of collaboration between our department and then with Jamie and his folks at the Division of Public Health, really taking their expertise and making sure that our childcare providers have the information that they need so that they can make sure that, again, these environments are safe for children and that parents can feel comfortable sending their children back to care. So again, June 15th, you're able to send your child back to care. All providers are allowed to open, and the Office of Child Care Licensing is working with providers because we know that there are a lot of questions, understandably, that are coming from those providers as they weigh their decisions about staff and about supplies and things like that. And really the name of the game has been collaboration and really just working with those providers on their concerns and their questions, again, to make sure that they feel comfortable opening, because we know that their main priority is the children in their care. That hasn't changed. So, and then, just on a personal note, I know that the decision-making process as a parent, I'm sending my own child back next week, and it was a harder decision than I thought. And, but it really comes down to being able to put your trust in your child care provider and knowing that, we, the folks at the state level, we care just as deeply as well about making sure that your children are going to somewhere safe every day, and that we're making sure that there are all the right precautions in place to make sure that parents can go back to work, children can get back to their routines and see their friends. And again, I know it comes with concerns, but we feel really comfortable with how we've been working with the Department of Education and the Division of Public Health to make sure that those environments are going to be those safe and comfortable places for children. And so happy to take questions, and thank you, Kim.
Sure. Thanks, Meredith. A lot of work has been done over the past few months, and we are 5 days out until, as Meredith said, June 15 hits, and we have lots of questions that we're going to dig into, but I'm going to turn it over to Jamie. Jamie, if you could just give us a quick overview of the work that you've been doing and any comments you'd like to share.
Sure. Thanks, Kim. So my name is Jamie Mack. I work as the Environmental Health Director for the Division of Public Health. For the last couple of months, we've been working with child cares and other businesses and individuals throughout the states to make sure that we have good guidance out there for how to go about our daily lives, in a safe manner under the current challenges related to COVID. And I've been working with child cares and a lot of other folks on cleaning and disinfecting, how to respond if they have a positive that's been in the business, and just a lot of the other challenges related to dealing with COVID. And just to add real quick, I do have kind of a personal connection to this as well, because my wife is a licensed family child care here in Delaware. So she and I have had a lot of conversations about that side of things, about how the kids, would deal with some of the restrictions we're putting in place, the social distancing, the masks. A lot of this stuff could be very challenging for providers, especially with younger kids. And just to echo Meredith's comments, I'm a parent myself. I understand the concerns about sending kids back to daycare, schools, into other environments. So we're certainly taking that very seriously, and we're doing everything we can to make sure that this is done in a safe way.
Right, thank you. I think the personal connections are really important here. I too am a parent of a young child, so we definitely want the public to know that when decisions are being made and discussions are happening, having that personal connection is really important. And we know that we can't speak for all families out there, but definitely having that approach in our thinking, I think, has definitely helped us make those decisions and put that guidance out in the way that we have. Last, but certainly not least, I'm going to turn it over to Melanie Thomas-Price. She is one of our providers that we have in the city of Wilmington. Her voice is so important, being so that she is a provider. We want to make sure that we are connecting with our providers as often and as quickly as we can, because at the end of the day, the guidance and the discussions and the decisions that the state makes has to roll down to our providers. So Melanie, please give us your thoughts, a quick introduction, and then we'll go ahead and turn to questions.
Hi, Kim. My name is Melanie Thomas-Price, and I own and operate a Leap of Faith Child Development Center. We have 2 sites in Wilmington. So we chose to stay open. And I tell you, when I think back to mid-March and where we are right now, I have to applaud my peers. I have to applaud them. We play a real crucial part and a role in the sustainability of our state's economy. And I don't want to downplay that, because they had an opportunity to close. And many of them decided that, you know what, we are going to remain open, boots on the ground. I remember when we made the decision, I made the decision with my staff, and I said, what do we want to do? Do we want to close? Are we going to remain open? Are we going to serve? And every single one of them but one, and I have a pretty large staff, they said, we're going to serve. They didn't blink. They didn't think twice. And so that's what we've been doing. It hasn't been easy. We've all had to practice patience, not just the staff, the parents and the children. Mm-hmm. I mean, try hearing the same assessment every single morning. After a while, it gets a little irritating. I think my staff is even getting a little irritated with me. You know, you're asking the same questions all the time. You want to follow the best practices. They're getting their temperature taken at the door every single day. So some of these things can be disheartening, but parents have been very patient and understanding, and I'm grateful for that.
Thank you. Appreciate your feedback on that. Okay, everyone. So I think we're going to turn to some questions. We've had some questions that were posted on the DHSS site, and we've collected some of them. So the first one is for Jamie. Jamie, in terms of public health guidance, what should child care providers know as they prepare for their facilities to reopen?
So I think the most important things are to communicate with your parents and make sure that they're aware of the symptoms they need to be looking for and the other signs that they need to maybe take a step and not bring the child that day, or, you know, maybe reach out to the doctor, get some information if there's any of the symptoms related to COVID. And then, you know, I think another piece is the cleaning. That is going to be one of the key pieces for the child cares. We understand the challenges with the masks and the distancing of young kids. So cleaning becomes, you know, an absolute key. We wanted to be doing it frequently. Just wiping down shared toys, wiping down high contact surfaces, things like that. That's going to be one of the best steps that we can take, particularly in an environment where, you know, the distancing, the masks, you know, some of the other things that we're using as protective measures are very, very challenging.
Thank you. Absolutely. You know, being a former provider myself, I remember that, you know, the bleach and water bottle process in the morning and getting that ready and using it. And, you know, once again, I echo what Melanie said. We have to applaud our child care providers over the past, you know, few months. They really have been doing what they've always done, but even with a more central focus because of this pandemic. So seems like the guidance that keeps coming out remains focused on all of those things: masks, social distancing, but the cleaning and sanitizing is something that our providers know well. They do it every day. And Melanie, you could probably add, they're probably doing it, you know, even more so now than they already have. But those practices, those best practices that providers have been following for, you know, forever are certainly making a difference. You know, they are doing what they need to do to keep children and families and staff safe. Meredith, I'm going to turn to you really quickly from a family perspective. What should families know about childcare as we move forward? You've mentioned as they think about sending their children back to care.
Sure. Something else that is part of the requirements for any child care facility that's going to be reopening, or, you know, in a provider like Melanie's case, continue to operate after June 15th is they all have to have a plan. They all have to have a plan. It has to be in writing. We provided a template that includes a lot of the recommendations from the National Centers for Disease Control, as well as additional more specific recommendations from our Division of Public Health. And then also some best practices from other states that we see as they're going through a similar process. But all providers have to have this written plan where they can kind of pick and choose elements. Obviously, all the required elements have to be part of the plan, but there are additional elements that they can kind of add on so that they can feel a little bit more prepared and, you know, have additional resources at their disposal in terms of those best practices. A lot of it goes to some of the cleaning and sanitizing practices like Jamie was talking about, and then some additional things that they can take into consideration for social distancing, because again, like Jamie said, like Melanie's touched on, social distancing is really, really difficult for these young kids. So providers really do have to get creative, and they have been getting creative. We know that. And so again, going back to that plan and really knowing what they need to do if there is a child that has that does have a symptom that is concerning. Who do they call? What do they do next? Or if they have a staff member who you know, either tests positive or is exposed to someone who had tested positive, what do they do next? So that really providers can feel prepared, and then they can communicate that preparedness to the parents so that parents can really feel a little bit more comfortable that their providers feel equipped to handle this situation that really all of us are still kind of learning day to day what the best thing to do is. So that's really the main thing. And then the other thing is really that, you know, the Office of Child Care licensing and all the staff there are, you know, they're here, they're still working, you know, they're like us, they're still kind of remote at this point, but they're just a phone call away for these providers if there's questions, if they're wondering about a certain situation, something that they'd like to do, and they don't know if it's you know, against the rules or not, you know, they can always reach out. And, you know, I get lots of questions, and then usually I call Jamie or someone, and we figure out an answer, and we really try to help the providers, because they want to provide as normal of an experience for these kids as possible. And so we're also all on the same page there too, where we're really trying to work on what can we help providers do for these kids to, again, give them as normal of an experience as possible. And that might mean some adapting to some of the restrictions that, again, are there for a reason. But again, we're really just here to help kind of troubleshoot those situations. That's something else on the provider end, and also on the parent end too, because we know that parents want their kids to go and learn and have a good time, you know, the way they were before all this happened.
Thank you. So I think, you know, what I'm hearing Meredith say is, you know, communication is key, and there's lots of different mechanisms that the state has, you know, put out to ensure that. But at the end of the day, if families have questions, they should talk to their provider. They should, you know, be able to, you know, to express any concerns. And then if questions that they are asking, if providers are unclear or unsure, then there are ways for them to get answers, whether it's through their licensing specialist, whether it's through the guidance documents that the state has already put out. But talk to your provider and ask those questions, because I'm sure, you know, if you are a family member who has a question, there's probably other families that have the same question. Okay, Meredith and Jamie, and even Melanie, I asked, you know, everyone could probably jump in on this one. We have some people, folks who are concerned about staff members coming back who might be vulnerable to COVID, right? They have compromised immune systems, other underlying health issues. What precautions are or should child care centers take to keep those individuals safe? Or what are you doing, Melanie? It might be a question for you a little bit later.
Anyone that took an extended time off, they need to be tested before coming back. And people have been very good at that. Look, Kim, this has been a cultural shock. Ever since the onset of COVID-19, it's been a cultural shock to our industry. It has absolutely changed the way that we do business. I mean, that's without a doubt. Even for the children. I mean, everything about, when these kids return, and many of our kids have been coming the whole time, but when the children begin to come back, the way that they left their child care center has changed. Completely. Much about it. In one of our meetings last week, I believe someone from the CDC said that we probably really shouldn't be singing. Now, we've been singing to children forever. This is what we do.
What we do.
There are so many changes, yes, that have taken place. I don't want us to get, and I tell my staff this all the time, I don't want us to become complacent. Just because we're getting some normalcy, which is wonderful, I have no problem with it. But as leaders, we're going to have to ensure that we don't become complacent, because COVID-19 is still a threat. And I don't want that to get so far in the rearview mirror with us going to the beach now and having, you know, we have to keep that before us.
Correct. Jamie, from the public health side, you know, what certain precautions or guidance would you give programs if they have staff who are nervous about coming back because of these issues?
Well, I think Melanie made a very good point in that it's important we not become complacent as we move towards normalcy, because that's going to be one of the biggest dangers, especially to the vulnerable populations. If we start to move away too quickly from any of the precautions that we're taking now, that's going to pose an extra risk, especially to the vulnerable. Now, for individuals that may have an underlying condition or otherwise be, considered a vulnerable population, it could be things like, for their specific situation, if there is an underlying condition, maybe consult with their primary care provider, just so they have, some information from that perspective as to what might be the best path for them. In larger centers where there's opportunities maybe for some positions or duties with a little bit less of a contact, a little bit less public facing, whether that be administrative functions or something like that, that's definitely something that can be considered for some of our more vulnerable populations. But really the most important thing is, if they choose to come back, would be to pay close attention to the masks, the distancing, the hand washing, the hand sanitizing, everything that we're recommending for everyone. And again, that just goes back to the complacency. If we continue to do these things, we're going to protect ourselves as well as the children in our care. And if we have additional vulnerabilities, as an individual, it just becomes that much more important to take those precautions seriously and make sure we're doing them consistently throughout the day.
Right. So the message here is remain steadfast on the practices that we've been talking about for months. Like you said, hand washing, social distancing, wearing of masks, and more frequently, right? Child care providers and children who are in care wash their hands all the time, right, Melanie? All the time. So now even more so with washing hands, the adults and the children, to make sure that you're right, cleaning surfaces down, keeping social distancing as much as you can with, young children, which is, a challenge in itself, but those practices have not changed, so everyone needs to, be clear on the fact that hand washing, social distancing, wearing masks, and then, other types of sanitizing is really the guidance moving forward. It hasn't changed, right? It's the same.
Yeah. And you know what, I'll add too, because Melanie did mention singing, and we've had a lot of conversations at DPH about singing, whether it be in choirs, daycares, or the various settings. And the concern is, whenever you're singing, speaking loudly, presenting, anything like that, when you're trying to project your voice, you're also projecting the droplets that may be carrying the virus. So that's one of the concerns, and is another reason to be wearing the masks and things like that. We just need to be very cognizant, very aware of what we're doing and the things that we're doing that could spread virus or could expose ourselves to virus as we continue to move forward here.
Okay, thank you, Jamie. All right, I'm going to shift again to Meredith and to Melanie. Can you all talk to us about some of the services that might be available to providers or to families, just about how to talk to children around the pandemic? What have you been doing, Melanie, to brace the children for, when we had the masks come in, or, now their teachers are wearing masks, or if you had to do the temperature checks? Those are uncommon visuals and things, procedures that children are not used to. So Melanie, do you want to start off by giving us a little bit of a insight about how you have talked to your staff and to the children about these changes?
Well, we use an acronym, ICE. I is for information. So we've been gathering information, of course, from the governor and from the division departments. And as I get the information from you all, I give it to my leadership, and we communicate, and we make sure that parents get the information. And we have been utilizing circle time like never before. We have been using puppets like never before. So we got to be able to use teachable moments. We got to make sure that parents are getting the information that they need. As we get the information, we get it out to the leadership gets it out to staff, and we make sure that parents have it. And then the children also have to have it as well, because this is affecting them. Their behavior also has to change, which is very disheartening. We're so accustomed to leaning in. We can't lean in like we used to lean in. A lot of those things have changed. Small things like during lunchtime, we would use maybe 2 tables so that the kids could be close and have a conversation and just enjoy each other. Now we're spreading them out amongst every table that we have in the room. We're keeping a chair between children. You know, we're trying to have space. So they're really not accustomed to it. Circle time. They have to have a specific place to sit. So we're kind of discouraging things that they're accustomed to doing. So this becomes really uncomfortable for them. And we're constantly reminding them because, again, this is what they know to do. This is what we've been training them to do forever. So it's a learning curve. It's a learning experience for us all. So we're training and we're retraining. And that's what you're going to be doing. You know, as centers begin to open back up, they're going to be training and they're going to be retraining because everything is so fluid. Right. From the very beginning, week by week, I was changing memos. Things were changing that quickly.
Right. I'm glad you brought up training. Meredith, I just want to add something and then I'll shoot it over to you. So the Office of Early Learning, we know that training is essential, right? And the professional development and the types of resources and technical assistance we can offer to providers during this time is essential. So a few things I wanted to make sure the audience is aware of. We, in collaboration with all of our state partners and some other partnering organizations, put out a document yesterday entitled Reopening Childcare Safely in Delaware. So Melanie, you should have that in your email. If you don't, let me know. That went out and it really is a collection of all of the guidance from DPH, from the Kids Department, DHSS, our office, all in a one-stop shop for providers. So it's going to list all the current guidance for phase 2, as well as some CDC recommendations and best practices from some other states that we're partnering with. And this is going to serve as the first resource that's available to programs. We're having a webinar on Thursday for providers to go through this document on the interpretation of it. Betty Gail Tim is going to be partnering with someone from STARS to do that. And we're going to be having webinars like that are going to go into the weeds of the document to really talk about what do you do at lunchtime? Just like you said, how do you space children out during for tables? How do you talk to them about masks and why they can't sing or why we're not singing in a certain way? So we know that training and technical assistance is key during this time, and we will start rolling out resources over the next few weeks to really help providers and programs understand what they need to do and how they can individualize it for their program. So I wanted to make sure people were aware of that.
Great.
Meredith, would you add anything else about services that are available for children or families or providers?
Sure. You know, Melanie touched on really everything, and you, Kim, as well, about the more expansive guidance document that's available to providers. Something else that's available through our department is the early childhood mental health consultants. They are licensed individuals who they basically, any childcare provider can reach out to them and request their services. As a parent who's sending her child back next week, I've tried to make it so it's less scary, I guess, you know, normalize it a little bit, because it really is, it's going to be our new normal for a little while, not just in childcare, but as businesses start to open up, you're still required to wear a mask as you go into different stores and things like that. So if you do have your children with you, they're going to be seeing people wearing masks. And so it's important to talk to them in an age-appropriate way, make sure that they see you wearing one so that they don't associate it with something scary or negative, hopefully, so that when they do make that transition back to childcare and their teachers who, you know, before they left, you know, weren't wearing one, but they're wearing one now, you know, they can be a little prepared to see them that way. And, you know, again, you know, like Melanie has talked about, and like you, Kim, I mean, this is what teachers and providers do. I mean, they know how to talk to kids probably.
So can you talk through what the actual state guidance is for children wearing face masks?